course, need a sphygmomanometer with a blood pressure cuff. And of course, a blood pressure cuff is not one size fits all.
The largest blood pressure cuff is known as a thigh cuff, although this can be used on a patient who has a very large arm. The width of this cuff is approximately 18 centimeters. The next largest cuff is known as a large adult blood pressure cuff, and this one is approximately 15 centimeters wide. Then we have the normal adult blood pressure cuff, and it is about 12 or 13 centimeters wide. And finally, we have the smallest blood pressure cuff, which can be known as a pediatric or small adult cuff, and this one is about 10 centimeters wide.
To determine which cuff is appropriate, we need to measure two different variables on the arm. We measure the width of the blood pressure cuff against the patient's arm. The width of the blood pressure cuff should be approximately 40% of the circumference of the arm. Also, determining the total length of the bladder of the blood pressure cuff, which is where the tubes come out of the blood pressure cuff. When you wrap the blood pressure cuff around the patient's arm, it should approximately be at least 80% of the circumference of the arm.
The length of the bladder does not represent the entire length of the blood pressure cuff. Notice where the tubes come out of the blood pressure cuff, and notice that that area is thicker. This is where the bladder of the blood pressure cuff is, and it's the length of the bladder that we're interested in, that should be 80% of the circumference of the arm to be the correct size.
So a normal adult cuff fits that just fine. You go ahead and place the blood pressure cuff snugly on his arm. You'll notice I'm approximately 2.5 centimeters above the antecubital fossa. Bates will record blood pressure with the bell of your stethoscope, but I think you'll find most physicians at Loyola use a diaphragm to measure blood pressure. Again, the blood pressure must be taken on skin. It shouldn't be taken over an article of clothing or the patient's gown. And the patient should be relaxed and calm. Don't check the blood pressure. The patient just rushed into your office, they're late, or if they're crying, because of course the blood pressure will be elevated. First, we're going to check the blood pressure by palpation. Simply identify the radial pulse, tighten up the valve in the blood pressure cuff, and by watching the sphygmomanometer, I'm going to determine when I stop feeling the radial pulse and blow up the cuff approximately 20 beyond that. And I felt the pulse disappear about 110. As I released the air from the cuff, I felt it return about 110. This tells me that the systolic blood pressure is approximately 110. So when I go to auscultate the blood pressure, I know I only need to auscultate above about 20 millimeters of mercury, approximately 110. I don't need to blow the cuff all the way up to 200 and to hurt his arm. You notice that the brachial artery should be about the level of the heart, but the patient's arm should also be relaxed, so you as the doctor should be the one holding the arm up. Don't ask the patient to hold their arm up, because that again can falsely elevate their blood pressure. So close the cuff in the valve and then slowly blow it up again, about 20 points again beyond where I felt the blood pressure disappear by palpation. I'm going to slowly release the air. The point at which I first heard the blood pressure pulse return was 116. I heard the pulse disappear at approximately 76. So the blood pressure by auscultation is 116 over 76. And of course I'm going to repeat this in the other arm, both by palpation and also by auscultation. And again, it's important to use a right-sized cuff, because if the cuff is too small, it'll falsely elevate the patient's blood pressure, and you may diagnose the patient with high blood pressure, hypertension, incorrectly. So let's finish up with blood pressure by reviewing some of the common